Well, this is a really life-changing incident. Um, as I had mentioned, I have lupus, but on this particular occasion, I had to go on chemotherapy. Um, my system was really out of whack, so to speak. And so I started out taking this pill orally. And she said, you know, your period will stop while you're on this pill. And then once you finish the treatment, you will have your period again. And I said, okay. I was early 30s, still pretty young. And so I finished the treatment over several weeks and then, stopped the pill and, was waiting for my period, nothing. So I called my doctor and she said, oh, come in, and I said, I haven't had my period yet. And I said, it's been almost 2 months. I should have had it a good 3 or 4 weeks ago. And she's like, okay. She's like, okay, well, let's do some blood work. And she's like, give us a few days, we'll let you know. So I was like, oh gosh. And so I recall I was at work. I was working for the Boston Public Health Commission at the time. And I got a call and it was the nurse at my doctor's office. And she's like, how you doing? I'm like, I'm good. She's like, just wanted to let you know, we got your blood work back and you are infertile and your doctor will be calling you. Have a nice day. I remember people rushing into my office. I don't know if I screamed or yelled, but it took me somewhere else. And people were comforting me. You okay? You okay? I didn't even know I screamed. I was crying. After I kind of came to it, someone's like, okay, someone take her home. Take her home. I was shocked. And the way in which they told me, just so cavalier, no kind of compassion, no kind of caring. And so my mom was home. We had lived together at that time. She was retired. And someone came home with me and my mother was like, what's going on? And I couldn't even tell her. I was like, oh my gosh. We are a family of trillions of kids. We love babies. I always imagined having babies. And they just said no. And so my mother called the office. I was upstairs crying. I heard my mother. She was livid. How dare you say that to someone in that way? You should have actually had her come into the office and meet with her face to face and have a conversation. And my mother called the president of the hospital. It was a big, big, big deal. And the doctor was transferred. The doctor did call me, and it was a female doctor. It was a woman doctor. Well, you would think she'd have a little more heart about it. But that really broke me. That just crumbled me like, oof. And looking back, and then we had this conversation with some of my other doctors, it's like, Hope, you weren't even presented with any choices. Like, in case your period doesn't return, maybe you want to freeze some of your eggs before you have the treatment. And everyone's like, well, if it was a white woman, it's much more likely she would have been presented with some options before the treatment even started. There's statistics that shows that white women are offered options as opposed to black women. Black women are just kind of shut down and say, well, this is what you have to do. That's it. I wasn't even thinking that way at the time, but of course, I had some choices before this treatment, and it was horrendous. Yeah. I could have been depressed and just given up. But that's not my attitude. That's not my mindset. I said, okay, so I can't go that way. I got to go this way. And so soon after, I said, well, there's more than one way to getting a child. And so I thought about adoption. I had a girlfriend that had recently adopted and started talking to her. And so working on the new plan brought me out of that darkness, but it also taught me to ask more questions. So that was a learning moment. Painful, but a learning lesson. I'm like, oh no, anything that is presented to me medically, I'm going to ask questions. I'm going to look it up myself on the internet. I'm going to ask other people, have you had this? And really do it differently.